Hello everyone. Today I'm going to be talking about Paula. Paula is a 50-year-old married Hispanic woman who presented in the psychiatric emergency room at the urging of her outpatient psychiatrist after telling him that she had been thinking about overdosing on Advil. So Paula recently had a fall, to which her neurosurgeon recommended rest and some non-steroidal anti-inflammatories. Um, she did not like this treatment, and that's part of the reason why she's reacting this way. So her biological background, as mentioned, she's Hispanic. Her treatment history, as mentioned, is rest and non-steroidal anti-inflammatories. And then she was also prescribed with SSRIs for her depression, which she said they did not help. Her family history, she has a 73-year-old husband who she mentioned is a very famous musician. And she also has a 25-year-old son that is married with one young son that lives nearby. Her emotional responses and observations, she seemed to be downcast and depressed. Also, she said she had poor mood most of the day. She felt abandoned and not cared by the neurosurgeon. She feels like the way that she treated her was not the best. She seemed to be upset that she gained weight because as a result of the SSRI, and her husband is not supportive and not compassionate with her. She also said, no, she also seemed to be somewhat flirtatious with the male resident that interviewed her. And finally, she said that she missed seeing men jump through hoops to sleep with her. On the academic and work history, she had been working in this family-owned grocery store for many years. This is where her second fall happened, and she said that as a result of that help, she had a back pain that has been killing her. Some of her behaviors, so she said that she had suicidal thoughts, and that these were no big deal. And she also said, "Whoa, I didn't realize that they were such a big deal." She reported that it was just a threat to her husband to teach him a lesson, and her husband reports that she does this regularly. She has these behaviors in which, whenever she wants to get something out of him, she would say that she will threaten her life if he does not, and he just doesn't react to these situations anymore. She had not presented suicidal thoughts for 3 years on her outpatient psychotherapy. So there was no mention of suicidal thoughts in these 3 years. She said that the doctors were really nice and sweet whenever she told her story, so she enjoyed telling her story and seeing people's reactions and liking the attention on those situations. As mentioned before, she was flirtatious with male residents, and she said she was an early bloomer, that she became sexually active with much older men when she was just in high school. And finally, she said that dating had been the most fun thing she had ever done. So some of her symptoms, as mentioned, is first thinking about overdosing on Advil. Now we know that this was a threat, but we're still going to remain it as a symptom. The second one is the back pain due to the fall at work. The third one is she being depressed and downcast. Fourth one, we're considering attention-seeking behavior. And finally, manipulation. There is no registration or no mention of substance abuse or usage, and there's no trauma history mentioned. So there are some questions that I would like to ask her just to see where our diagnosis can go. The first one is, have you ever experienced traumatic experience, neglect, or sexual violence? This kind of like to aim towards trauma and see if there's a relationship there. Are there any periods of time during the day in which you feel more depressed? Just to see if depression is itself the underlying cause or is being caused by something else. Do you have episodes of intense productivity followed by depressive episodes? Just to rule in or rule out any hypomaniac or maniac and try to see if bipolar might fit. Do you have any history of spending, drug use, binge eating, or reckless driving? This is kind of to have a final point that might help us ruling borderline personality disorder. And finally, do you consider yourself as a bad person? What is your perceptions towards yourself? This might help us to make a difference between histrionic personality disorder and borderline personality disorder. So the rules that I consider were histrionic personality disorder and borderline personality disorder. Some of the rule outs were generalized anxiety disorder and bipolar. And I'm keeping on the shelf major depressive disorder and factitious disorder, just depending on what her intentions are regarding the back pain and her visit towards the ER. So first, my diagnosis is histrionic personality disorder. Histrionic personality disorder is a pervasive pattern of excessive emotionally and attention-seeking, beginning by early adulthood and presented in a variety of contexts, as indicated by 5 or more of the following. So the first one is uncomfortable in situations in which she or he is not the center of attention. We do not have much information on this, but it's something that we might lean towards given her behavior, but we're not considering one of the 5. The second one is interaction with others is often characterized by inappropriate sexually seductive or provocative behavior. As mentioned with the interviewer, she had this kind of behavior with her flirtatious actions. The third one is displays of rapidly shifting and shallow expression of emotions. We do not have record of this because we did not really interview her directly, and it's hard to take into account those reactions, but we're still keeping it as a maybe, but it's not counting on the 5 that we require. The fourth one is consistently uses physical appearance to draw attentions to self. As mentioned, she was the best dressed person at the ER, so she was outstanding in a way from the crowd, so definitely that counts in. Number 5, has a style of speech that is excessively impressionistic and lacking in detail. So reading her interactions with her husband and how he treated her and how she seems to act and react toward how things happen, there's a constant question that is why or how, and she tends to keep those pretty simple, so we're taking that one into account. Number 6 is shows self-dramatization theoretically and exaggerated expression of emotion. Given her relationship with her husband after so many years and how he perceives her as very dramatic and trying to take control of the situations, this one will be taken in. Number 7 is suggestible, so easily influenced by others or circumstances. I did not take this one into account, but we might suspect it might be given her relationship with her husband, he being much older. So we're not taking it into account, but we could really look more into this one. Number 8 is considers relationships to be more intimate than they actually are. So she fits into these relationships. She said that everybody was enjoying her and giving her so much attention whenever she told the story about her fall. So somehow she has this perception of relationships being a little more intimate than they are. Now I'm gonna talk a little bit about borderline personality disorder and why it is not our diagnosis, but it might fit depending on if we get the results from some of the questions that I asked. So borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning at early adulthood and presented in a variety of contexts, as indicated by 5 or more of the following. So the first one is frantic efforts to avoid real or image abandonment. So in a way she feels abandoned by her husband, so we're taking this one into account. Number 2 is a pattern of unstable and intense interpersonal relationship characterized by alternating between extreme ideations and devaluations. Her relationship with her husband has a lot of this. First, she says that he mistreated her, that he, in a way, doesn't treat her well, and then she says, oh, he's a great musician, famous, and talks highly about him. So this kind of gives us an insight into this. Number 3 is identity disturbance marked by a persistently unstable self-image and sense of self. We do not have information on this one, so we're not taking it into account. Number 4, and this is the one that the question will be affecting is impulsivity is at least in two areas that are potentially self-damaging. Some of the examples that the DSM-5 gives are spending, sex, substance abuse, reckless driving, binge eating. So we have some insight into sex, but we don't have into a second one, so we're keeping this one as a maybe. Number 5 is recurrent suicidal behavior, gestures or threats, or self-mutilation behavior. As we know, she's been threatening for the longest time, so we're taking this one into account. Number 6 is affective instability due to marked reactions of mood. We do not have any information of how she reacts, if she's irritable or if she has episodes of being super intense. So we are not taking this one into account. Number 7 is chronic feeling of emptiness, as we said before. She feels downcast, depressed, so a little bit emptiness there. Number 8 is inappropriate, intense anger or difficulty controlling anger. So there's no information giving these kind of emotional reactions. Number 9 is transient stress-related paranoia, ideation, or severe dissociative symptoms. There's no information on this either. So that gives us 4 just at the border, so we're keeping it right there. So what's the differential between borderline personality disorder and histrionic personality disorder? So although histrionic personality disorder can also be characterized by attention-seeking, manipulative behavior, and rapidly shifting emotions, borderline personality disorder is distinguished by self-destructiveness, angry disruptions in close relationships, and a chronic feeling of deep emptiness and loneliness. So the sense that we get from this patient is she's not so self-destructive from what we know. She seems to be more in the notion of trying to be attention-seeking and trying to be more manipulative. She's really looking for those search for attention from her partner, from other people, and so this might be a hint towards histrionic personality disorder. So what will be the treatment for histrionic personality disorder? So psychotherapy will help her. Through this process, she will address the motivations and fears associated with her thoughts and behaviors, and also to help her learn to relate to others in a more positive way. They might also include medication just to target those distressing symptoms such as depression or anxiety that might co-occur with this personality disorder. Thank you everyone for watching. I hope you liked my video.